One person wants to know any treatment for exon 51 deletion.
The exon 51 deletion. I think, if it is an out of frame, I'm looking at the dystrophin chart. If it is out of frame, I think again, going back to what do you mean by any treatment? If it is gene transfer, yes, they would qualify for that. Of course, again, all the standard of care treatments you have to do. Yeah, there's nothing specific, but yes, there's gene therapy treatments are available. The ones in the clinical trials, all the other clinical trials, they would qualify just based on the exon 51 deletion.
Is gene therapy treatment available in Canada?
I don't think it's approved in Canada yet. There might be the older boys clinical trial going on, but I don't think it's approved in Canada.
Okay, so I mean, these are the questions that people have generally asked and they have put. And if anybody has any questions, you can please raise your hands. And we really appreciate the doctor has taken a lot of pains and is very patiently answering our questions. And we really appreciate that.
If I'm able to help some, I think that's good.
How do we start NMC centers, certified centers in India? How do we need some guidance from you? I mean, what should be the basic doctors or the setup that should be there in any NMC in India?
Right. I think that's a great question. I'll be in touch with you guys because I'm working with I've started discussing an idea working with PPMD in the United States to do something similar here in India. But definitely we should collaborate on that and talk about it. We can continue that conversation for sure.
Yeah. Rama, any more questions you have?
No more questions as in the chat box or any more questions. Sir's email ID is being shared here. They can write. And I would like to mention to the group here about Dr. Aravindhan. We have been in touch from the first reported case. We had in this year, January, I think one of our family had committed suicide. At that time, he has written to us saying what is all about, what is going on in India and all. From that day, every day, I mean, every month on month, I believe he's following us. He's knowing what the work we are doing. From that day onwards, he was ready to help. Whenever, Rama, whenever it is possible, I am there for you. Thanks a ton for the words, doctor. It's been very, very encouraging. And I was also very much touched after knowing that you are one of the best friends of Dr. Karliti, Shashank Karliti, Dr. Santosh's brother. Based on, I mean, after that also, like he was also very cooperative, and he was also expecting the same thing, something to be done for the muscular dystrophy community in India. And we appreciate your concern and support, and we seek the same support from you henceforth. I have been pushing you for one endocrine session, one that session, this session. Thanks. I mean, it is difficult for us.
No, if we need more, we have, we can arrange for future. We have cardiologist. I can help bring him in. We have endocrinologist. Any specialist pertaining to Duchenne care, I'm happy to help.
We need,
work with them, organize a session and stuff like that.
How do we as parents, one minute, how do we as parents bring gene therapy to India? Any lobbying with the government or pharma companies will help, you think?
I think definitely no. As an advocacy organization, of course, the families have you have a strong voice. I think I think that would your voice would be heard more than in as physicians going. And definitely lobbying with the government would definitely help. So the companies may be willing to help, but I think what I hear is there's a lot of challenges that they face with the government. And I think that's where we need to work on
the regulatory practices.
Yes.
Yeah, you can go on. Thank you so much, doctor, for a very, very informative and insightful session for all of us, and it is really, really appreciated. And Rama, you can carry on. Sorry, I cut you short.
It's okay.
Please carry on.
It's okay, ma'am. Murli has a question to sir.
Yeah.
Hello, doctor. This is Murli here. See, as a parent advocacy teams, we are, struggling in India to create one ecosystem to support our muscular dystrophy community. So down the line, 2 years, we are planning to have as many as neuromuscular centers across the India. And then in that process, we are planning to have the, knowledge sharing, all knowledge transfer sessions to the doctors first. Okay, so that, we can reach more patients in India. So we want even more, help in that lines also.
Yeah, no, I think, like I said, my vision is also along the same lines, which I've started to work here. I cannot share a lot of details now, but I definitely will talk more about it. To start off a process where a group of experts from United States would travel every 6 months or something like that to start the education and help setting up centers. I think you're right. Even we can set up centers, but we don't have the expertise in India. I don't think there's. Maybe you can handpick few people who know what they're doing throughout the country, but they all need more awareness and education, which I think again that's a vision for me, which I'm planning on, which again we will definitely collaborate as things move on. We continue to discuss that.
Yeah, great to know, sir. Actually, we have done 2 sessions in that line that we named like a caregivers meeting, where we collected all the treating doctors the information from the patients, and then finally we came to know that most of the doctors are not well aware how to deal this muscular dystrophy, in particular in the DMD cases. That is the reason we can find the most of the patients are not on the steroids, on the standard of care, even they are not taking care of the cardio and then pulmonary and the endocrinology issues. Even doctors are not even ready to suggest for the BiPAP machines or all other supporting devices, which are very essential at the later stage to the patients. Then we thought that this is our area of, educating the medical fraternity. I'm very sorry to express the same thing with another expert of the same field, but that is the ground reality. So it will be very helpful, to have that, every 6 months to have this sort of sessions.
Yeah, definitely. We'll continue that conversation for sure. I know that's something that I want to do, and I'm working on doing it. So I think it would be great to collaborate on that, and we'll continue the conversation on that.
Great, sir. Great to know that. Yes,
Yeah.
Sharda ma'am.
One parent has raised the hand, Ajay Garg. So should I get him in?
Sure. Yeah.
Yeah, Mr. Garg, if you're there, can you please talk? Raise your question. Hello?
You can unmute, Mr. Ajay.
I don't think he's there.
Yeah, here is.
Yeah, so I just saw his hand raised. So
I have given the access.
Hello.
Yeah, Hanji, boliye.
Yes.
Hanji, hello, Dr. Sir. Hello. Sir, in which way we connect to in USA hospital for treatment gene therapy?
So you have two options. You can email me, or you can also reach out to. If you go to Sarepta's website, they also have a contact there, and they can based on they can put you into, again, they're gonna put you back in touch with either myself or a couple other centers that they're doing gene therapy.
What is your mail address, sir?
I think it's in the chat. I'll write that again.
Ajayji, it's shared in the chat.
Okay. And sir, in what time we stay in USA for this treatment?
So we can talk about that once we start discussing it. It's I can quickly say it's going to be about three months around the time of infusion. You would have to stay in the US, and then you would probably have to go back and forth, and we can discuss that after that. But for the first 3 months, you would be staying here.
Sir, this is possible that if I approach to Government of India, this gene therapy is available in India?
I don't know. You can discuss that if you talk to. I mean, I don't know if you have any connections. I'm happy to facilitate if if you want to be talk to someone. But definitely you can talk to the government if you have any connections for sure.
Yeah, we have Sunil Kumar raising his hand earlier in the session. Sunil ji.
Thank you, doctor, for a great section. I already put on my question in the chat box and I got first answer. Hello. Then one question, sir. Can you briefly set about the inclusion criteria for the gene therapy and Capricorn?
Oh, for Capricorn, for Regenex Bio, I think Sarepta gene therapy and Pfizer gene therapy programs are completed recruitment in the US, so they're not recruiting anymore. For Regenex Bio, it's like I said, it's 4 to less than 12, and the boys have to be ambulatory. That's the main one. There are other things which we have to go through. Those are the main ones. For Capricorn, I think it's 10 and older, could be ambulatory or non-ambulatory.
Sir, one question, sir. My son deletion is 3 to 28, and actually it is DMD. My question: what is the difference between the in-frame mutation and frame mutation? So, actually, 3 to 20 comes under the frame mutation, but our research shows it is a DMD, not BMD.
Okay, yeah, I'll share. Yeah, give me 1 minute. I'm going to share the screen with you all. Give me 1 minute. So I think, we know for Duchenne, there's no dystrophin protein is made, right? Whereas in Becker, there's some amount of protein is made. Do you see my screen?
Yes, doctor, see it, yeah.
Okay. So if you look at the screen, this is what we call the exons, or different pieces within the DMD gene. So as you see, you have 79 exons, right? And you see each one of them is in different shape, so they can fit like a puzzle together. They all fit together. So this is how normally the DMD gene is. You need exact setup to actually make dystrophin protein, and that's important for your muscle. So so if someone, for example, has, I'm just making this up, right? So has exon 50, meaning the exon 50, that piece is missing in them, right? If that's missing, the 49 and 51, if you look at this, they cannot fit the puzzle together, because you have a straight line here, there is a circle here. They don't fit the puzzle together. So they can't make any more. As the message comes through this whole loop, it stops right here because there's no connection from 49 to 51. So this is out of frame mutation, and this causes there's no dystrophin, and this causes more severe phenotype, which is Duchenne. On the other hand, what was your son's mutation? You said
3 to 28, sir. 3 to 28.
3 to 28.
28.
Right. So if someone has, again, you can take this as an example, from 3 to 28, it's missing. Even though the whole chunk is missing, 2 and 29, based on based on the shape, they can talk to each other. So even though the chunk is missing, they can still talk to each other. So this is in frame. The kids who have in-frame mutation, they can make some amount of dystrophin, and they have more milder presentation, or Becker-like presentation. Did that help you?
Hello?
Yeah, did that answer your question? Did that help you?
Sir, okay, sir. But is it BMD or DMD, sir?
It's in. So how old is he now, and how is he doing clinically?
Clinically, it's DMD, Duchenne.
Now, like, how old is he now?
Sir?
How old is he? What is his age?
He's 18. Now he's studying it engineering.
Okay, and is he walking, or is he in a wheelchair, or?
He's in wheelchair. He's in wheelchair.
How old was he when he stopped walking?
at the age of 15, 1-5, in between 15 and 16.
Okay, yeah. So it's more of what I call, it's intermediate. It's not actually complete Duchenne phenotype. It's more of what we call intermediate. So this is in frame, but there's a big chunk of exons are missing. So it wouldn't be considered as a Duchenne phenotype. It's what we call, it's slightly milder than Duchenne, but a little bit more severe than Becker. Becker itself is a huge range. So it's more of a mild, intermediate presentation.
Sir, he's eligible for.
Sorry, that's what I was going to say. If you go to clinical trials and stuff, he would not be eligible because of the in-frame mutation he has.
He's not eligible for the gene therapy.
He would not be eligible for gene therapy.
Okay, so is stem cell therapy or Capricorn?
So for Capricorn also, he may not be eligible. I have to go back and check. You can email me. I can talk about more specifics. But based on the mutation, he may not, because again, it's in-frame mutation. But I'm happy to, if you want to say email me the details, I can get back to you.
Okay, thank you, sir. Thank you. Thank you.
Yeah.
There's a parent who wants to know, this microgen gene transfer is only the way for gene transfer, and do Capricorn, is it doing something different? So
yeah, when you talk about the treatments, right? So gene transfer is the genetic targeted therapy. So microdystrophin, mini dystrophin. So those are the gene transfer therapies. Capricorn, age-wise, those ones, they're not gene transfer. They're targeting not the genetic change. It's just, they're targeting the muscle. So there's two different approaches.
Ms. Rimjim Nigam has raised her hand. So can you please ask your question? Yeah.
Sure. Thank you. Sir, my son, he's 5 years old and he's been diagnosed with Duchenne. So my question to you is, how can we sort of improve the mental well-being of our children, right? As he continues to grow, he will sort of fall behind his peers physically. So how can we make sure that he continues to have a positive attitude and has some kind of confidence in his abilities? So any best practices or any thoughts that you want to share on this?
Yeah, I think that's an excellent point. So again, I think going back to resources, right? So here in the United States, we try to involve a psychologist to help with the families and the kids. So to help them cope up from the beginning, not immediately after the diagnosis, but once they get kind of customized to it. So to help, to keep talking to them and to the kids, and when they come see us in the clinic, we also screen them for that. So I think that's, having a close connection. If you have a psychologist or therapist who can talk to them, start those relationships early on would help.
You think, sorry, these psychologists, they could help us, online. I'm not sure if there are some experts in India who can help, but.
So I think from resources in terms of, if you're looking just documents and stuff, I think it's available. I don't know if, here within the US, we have, telemedicine therapists, people actually talk through, like we do here, like Zoom call and stuff, but I'm not sure. We may have to look into that if anyone is actually doing that as international sessions, or even within India, if anyone is doing that.
Okay, thank you.
Rajisha Premraj, can you please ask your question?
Yes. Doctor, you just explained about the in-frame and out-frame thing by showing your slide, slide, no? So what actually is happening when it is duplication? Like my son is having exon 39 duplication. So what will be happening in that case if it is a duplication?
Yeah, I think so. How old is your son?
9 years.
And what is he? How is he doing now? Like, is he weak or?
No, he's on steroids.
Okay.
And we had a review like 4 months, 3 months like that we are doing. So he is okay now. He is like walking and all. He is fine now. And we are doing physiotherapy also. So
Yeah.
he is, as far as now, he is okay.
Okay.
So he's
All right.
having like falls, frequent falls and all. That is how we came to notice, and climbing up and all. So that has been little reduced. I can notice after these 3-4 months like treatment, which we are doing like physiotherapy and plus steroid. I can see that there is a slight improvement in that.
Okay. So duplication meaning you have 2 copies of those, right? So you have another 39 that's here, comes up here. So it doesn't really, it doesn't really stop the messaging. It still happens. So it's going to be more of a milder phenotype, kind of somewhere between Duchenne and Becker.
Okay, okay. So is there any chance that it will go to the Becker like DMD, or like
So I think, the only way to say that, if you can look at the muscle biopsy, see how much of it if he actually has dystrophin or not. If he has some dystrophin already there, then it's a milder Becker phenotype. Even
okay,
when we say Becker, right, within the Becker, there is a wide range. Some of them are, they look completely normal. They don't have no weakness and everything. On the other end, there is some weakness, but he's 9. He's still walking, maybe slight falls. I feel like he's in the milder
okay,
phenotype.
okay, okay. So do I need to do a test like we did the genetic testing like blood test? So that is how we came to know. So do I need to test him again, or like to see whether it is a milder thing or whether it comes to the BMD? So
No, I think once you have the genetic testing, you don't have to repeat the genetic test.
okay,
Yeah, I think
okay,
that's good. Yeah.
okay, okay. So okay, doctor. Thank you, thank you.
One request, Prajisha Premraj. Can you drop
Yes,
in? Yeah, can you drop in your phone number? Because as you mentioned, deletion. We are doing
duplication.
duplication. Sorry,
Yeah.
duplication.
Yeah.
We are doing some biomarkers related activity here in Hyderabad. I request you please
Okay.
drop in your mobile number. Thank you.
Yeah, sure. Thank you.
Yeah, doctor, I also had one question for it. My son is a young adult, age 25 and a half. He had been on steroids, prednisone for a year, but he came on the wheelchair, so the doctors felt it to discontinue as the benefits were less compared to the side effects. And so far, we have been trying different doctors at UCLA and Irvine, but then they did not recommend going on steroids for him after his spinal fusion surgery. So do you think he should be put on any steroids now? Because he developed issues after his spinal surgery.
So what kind of issues?
Sort of, he talks to himself a lot, and it's like his thoughts are not shutting down.
Got it. Yeah, I think that's probably why. I mean, he's 25. Yeah, it's gonna be more of risk versus benefits, and you have to consider all the other side effects. Again, I think I wouldn't push him to start already. Just to start steroids. Again, you have to look at what are the risks that's actually causing. I agree that there might be more risks compared to, especially if he's going to be on daily steroids starting now, and if he already has some psychological problems or anything like that, then I may hold back on that.
Because he used to see Dr. Perishay.
Okay.
And then, but his orthopedic surgeon, Dr. Rosenfield, said not to go for steroids. Perishay said, let's consider. So we just left it at that. So I don't know what.
Yeah, I mean, if I would, if you discuss with Perry, I mean, I know Perry very well. If you discuss with him the risk and benefits, if he thinks the benefits outweighs risk, I think I would probably go. I would trust what Perry says for sure. And then, even you don't have to maybe consider a small dose daily, or maybe you can do, do the intermittent dosing.
Yeah, but now that we have relocated to India, I don't find any neurologist here to consult. So that's a
Right.
big issue. Yeah.
Yeah.
And so how do I manage his whole, all the other cardio
Yeah.
and other things that he has, restrictive lung condition. So
It's a challenge.
yeah. Yeah. And somebody else, Mr. Venkatesh has raised his hand. Can you please come in, Mr. Venkatesh?
Yes, ma'am.
Yes.
Yeah. Sir, I have one question, sir. Whether these exon skipping drugs, they actually convert the DMD into milder BMD, sir?
So it depends on, they say it converts to, I can show from the picture how it works, but it doesn't completely convert them into milder phenotype. It just makes them it produces some dystrophin. That's all it does. And how the dystrophin is going to affect clinically, it's going to vary. It's variable based on the patient and when was it started and that kind of stuff. And and it definitely, I have seen it maintains, but it doesn't reverse, or it doesn't make them more stronger or anything like that. It probably keeps them where they are, or maybe slow down the progression also. The concept why they say it makes them better is, I'm just going to say an example here, right? So let's say someone has exon 50 deletion here, right? The 49 and 51 cannot connect, right? So what this exon skipping agent, especially if you're, in this case, exon does 51, let's take that eteplirsen. So what does it do is, exon 50 is already missing. This drug binds to this exon 51 and takes it out. So now the exon 49 can connect to exon 52 and make them produce a little bit of dystrophin. And that's why, they're saying it converts them to vector phenotype, but it's just saying that it's making them make a little bit of dystrophin. And how does that going to affect the clinical picture? It depends.
Sir, how long we have to continue with the exon skipping? Long, sir, or is there any certain period, sir?
Yeah, I think it's tough. Also, as of right now, it's lifelong. It's once a week. But there are other technologies that's being tried to see if we could add something to the exon skipping agent to make it stay more longer. So instead of doing once a week, maybe doing once every 6 weeks or once every 2 months, something like that.
Sir, one last question, sir. If you're going with the exon skipping drugs, so how long it will help a kid to have the ambulation prolonged?
Yeah, I think we don't have the data yet. Depending on, I don't think we have the data from eteplirsen or Amondys or Vyondys yet. But the overall, I think the goal is maybe delayed deviation, loss of ambulation, maybe 1 to 2 years.
Thank you so much.
One last question from Mr. Perumal Madhavan. We will end the session after this. Any more, please drop a mail, or you can directly mail to doctor.
Yeah, doctor, one question. What are the likely side effects of this gene therapies? Because generally they keep saying about liver toxicity and...
so there is a lot, there's a lot of side effects from gene therapy. I think it's all sound fancy when we say gene therapy, but the risks are very serious. The risks are mainly due to the immune reaction, like said, to the vector, to the virus we use, right? So major ones are, there's immune reaction because of the immune reaction, you can have liver injury. So you'll have liver enzyme elevation, and you can also have, some kids have nausea, vomiting about 2 to 3 days after the infusion. They can also have myocarditis, inflammation of the heart muscle that needs more treatment, and then the myositis, which is inflammation of the muscle, which I told you, and some of them have what's called thrombocytopenia, or low platelet counts, and also there is a condition called thrombotic microangiopathy. It affects the kidneys, into the kidneys. So immune reaction to all of these multiple different organs can happen. And then, of course, you guys probably heard about an older boy. There was a death in the Pfizer dystrophin gene therapy program. So that had happened also. And there's a death in the CRISPR program. So all of this, you have to take into consideration when we discuss the gene therapy.
Thank you so much.
Good afternoon, doctor.
Can I request Mr. Perumal Mathavan to please speak first? Later, we will give it to Mr. Bhisham. Is Mr. Perumal Mathavan?
Yeah.
Yeah, please.
Good afternoon, good afternoon, doctor.
Hey, yes.
I have one question. When we talk about this Regenex Bio and Sarepta, as you are saying, there is a construct difference. Will it make any big difference in the result, or both are same?
Yes, I think that's a good question. I think the companies, they're claiming that maybe slightly better from a construct and from the effectiveness perspective. But to us, I think all of these programs, even though they have slightly different gene construct, the concept they're using is the same. I think I do not expect a huge difference in the amount of dystrophin production and also the effectiveness of the protein itself, of the gene itself. It's going to be somewhat similar across all the programs. It's going to come down to the safety to decide which one is better.
Okay. But when in the case of solid, we have been told that solid dystrophin constructor is much better than this, so that may give a better result. Is it so, or?
So no, I think again, companies can say whatever they want, but I think from our perspective, I think it's all equally effective.
Okay. And one more question: as many other parents are worrying about their particular exon exclusion in the gene therapy. So in that case, you are talking about that immunosuppression. Can we try using the tacrolimus, which they are using for the organ transplant and all, which is said to be the best immunosuppression drug? Is it possible to do this so that redosing also possible? Then that 8-9 exclusion criteria also will be addressed in this.
Yeah. So one, in Regenex Bio, we are actually using sirolimus, which is similar to tacrolimus, as an agent. So it's prednisone, sirolimus, and then another one, eculizumab, which is another immunosuppressant. They're still excluding because they want to make sure it is safe in those boys who doesn't have those high-risk mutations. But definitely, yes, the plan is to expand to 8 and 9 deletion. We're implementing some of these immunosuppressants. Including...
So in the case of redosing, it is possible. We can try for this redosing of gene therapy in the future.
Yeah. We don't know for redosing if these immunosuppressants would help. You have to suppress the antibodies that are already produced.
One more last question. So when gene therapy is not possible for few parents, then the next solution is that Capricorn CAT 1002. Is it that CDC derived cells? How it will differentiate into skeletal muscle? Because it is derived from the cadaver cardiac tissues, right? So how it will differentiate into skeletal muscle? But we heard along with the cardio development, it gives some improvement in skeletal muscles also.
Right.
Is it so?
So yeah, when they first tried, they thought of giving it through the heart vessels, but then now it's giving through IV, intravenous. So it actually diffuses throughout through all the skeletal muscles when you give it through the IV. There are evidence from their what we call the phase 1, the preclinical studies also, that it actually gets into skeletal muscle and help with that improvement.
But they don't do HLA matching in Capricorn trial, right? Do they do HLA matching?
I have to check if they do HLA matching or not. Yeah, this is not exactly same as stem cells. It's slightly different.
Okay. Thank you, doctor.
The last one, Mr. Bhisham, you have raised your hand at the time. If your questions are answered, then it's been long time, almost 2 hours.
I just had one question, Doctor. Is there any research going on between brain and the impact of DMD or lack of dystrophin in the brain? Are there any research studies going on?
Yeah, it's a great question. Yes, there's been we have been doing some looking at the the effect of dystrophin in the brain and in cognition and behavioral neurocognitive problems, behavioral problems. Yes, there's been some work that's been going on.
How can we get access to those abstracts or something like that?
I think some of them are already published at MDA, presented at MDA conference. I think I can look and send some to you. I have some, and some of them will be published soon, so you would have access to that once it's published.
Thank you. Thank you so much. Thank you, Doctor, for a wonderful session, and thank you so much for your time and patience. And we really, really appreciate, and we are so grateful for this session. Over to you, Rama.
Yeah, thank you, Sharda ma'am, and thanks a ton for Doctor. It's been very, very long, very informative, and every question is being answered, whether it's a simple question, whether it's a clinical question, or it is a scientific, or whatever question is being. Thank you so much, sir. And we look forward for many, many sessions. Not so long, at least for half an hour or 1 hour. I'm so sorry, but I think we all in India are very, very futuristic and on hope. Though nothing is being done everywhere, when in all the seminars or webinars where you are also being part, many questions come from India saying when it is coming to India, or are you looking into Indian side or something like that. Every question or every answer is no. We look forward at least next year some hope in India. I don't know if any indigenous comes up. That is also very good. We look forward for more sessions from you. I know this is related to treatment, gene therapy, etc., etc. I wish to have one specific neurological sessions for DMD with you in some time, whenever you are free.
Yeah.
Thanks a ton to the group also. We request the same support from all the members who have joined. It is not run by foundation, is not run by 1 or 2 people or 1 couple or 2 couples. It's run by parents like you. And we wish all of us join one hand, come to a platform under one umbrella and move on. Something to be done to India. Sir, Mr. Dr. Aravindhan is also there to support us in all the aspects. Thanks a ton, sir. Any message to us, Dr. Ji?
No, thank you. I think, like I said, I'm happy to help and collaborate, and I think I agree with you, and that's my vision too. So I'm happy to help in any way I can. Like I said, please feel free to email me, anyone. I think I put my email address there, so happy to help anytime. Thank you, guys.
Yes, sir. We do publish your email ID in all the groups. And thanks a ton for this great informative session. Thank you so much.
Thank
you all. Very good night.
Have a great day, Doctor. And I thank all the viewers for patiently being there till the end. Thank you.
You're welcome.
Bye.
Yeah, those people who are there in the group now in the session, I would request, if it is possible, do support us by taking the membership of Bharat MD Foundation. We do want to do more sessions, informative sessions to the group. Thank you so much for joining. I'm ending the session. Thanks a ton, everyone.
Thank you. Good night.
Good night, Anita ji.
Yeah. Bye.